A study published in The Lancet has found that adults aged above 60 could indeed face harmful heat stress at just 1.5 degrees Celsius of warming above pre-industrial levels. Joining me now from the UK is Dr. Simon Williams, a public health researcher at Swansea University. Thank you so much for your time, Dr. Williams. So why are people aged 60 and over so obviously affected by dangerous heat at lower temperatures than younger adults?
Yes, that is the key finding of this study. And we knew somewhat that older adults were more vulnerable to extreme temperatures in either direction. Obviously, when we see really cold winters, we see a disproportionate number of deaths, unfortunately, and hospitalizations due to that. What this study has shown is that actually it's significantly less than we had previously thought, where it was perhaps 2, 3, 4 degrees above pre-industrial levels, so 4 degrees Celsius of global warming. The scary thing is we're already there. We're already on average about maybe 1.3 degrees of global warming above pre-industrial times. We're going to see more and more summers like this. This is not a one-off. And older people, as you say, are more vulnerable, partly because they have a lot of clinical conditions, maybe heart problems, other things that kind of predispose them to being more seriously impacted. And they have a less efficient ability to kind of sweat and cool themselves down than younger adults. So those are two big reasons.
But why did previous research underestimate the risks faced by older people?
I think that one of the limitations of previous research was they just looked generally across the population. So they didn't break down, as this study has, different. And of course, this is all modeling research as well. So it's projecting into the future, if you like, different temperatures by different age groups. And what they found, because of those vulnerabilities, people aged 60 and above, and particularly as real world data is showing, sadly, in Germany and France, as you just discussed, even older groups, it's potentially 80 to 90% of people who are dying as a result of complications to do with high extreme heat, that kind of intolerable heat stress, are over 60.
I have to say, the one thing that stood out for me from this study is how it warns that some tropical and subtropical regions in the world could effectively become uninhabitable for older people. How realistic is this scenario?
I think it's totally, sadly, realistic, in the sense that you've got a kind of a double whammy, where people who live in certain countries, whether that's parts of Bangladesh, Southeast Asia, where there's really high humidity. So that's a bigger problem, where you've got high kind of air temperature, but where the humidity is high, and people who've traveled to countries like that may experience that, where you just can't cool yourself down through sweating. That's where things like air conditioning come in. But of course, a lot of these countries, and certainly parts of those countries, are quite poor, lower income, and thus we're going to have these big global inequalities around people that are able to kind of cool themselves as temperatures rise, and even on a more local level in countries like France and the UK, where those who can afford it will be able to kind of redo their homes with air conditioning, and those who won't will suffer more.
And this is clearly a massive global health issue. And as we just heard there from our correspondent in Berlin, already governments are passing the buck between federal and state level. So, it does appear that climate adaptation is not being adhered to the way that it should by governments or public authorities alike.
Yeah, I think so. I think we are, unfortunately, really starting to experience, because in previous summers we may have, in countries in Western Europe, appreciated almost the added warmth. I think we're really starting now to understand, and other countries more so, how global climate is impacting our health. And there is, of course, damage done, but we need to both look at how we can kind of reduce and offset climate change, but at the same time think about how we can help people, particularly these vulnerable older adults, because another risk factor is isolation. A lot of older people can sometimes be isolated. We need perhaps more investment and policies to help that. Some countries already do this, where there's actual regulations around working temperatures, again, for manual outdoor workers having breaks, or legal requirements that they don't work in certain temperatures. So there's definitely a lot we can do, and I think we do need to take action soon.
Dr. Simon Williams from Swansea University, thank you.